Hey there, welcome. If you enjoy educational content about sex, sexuality, and relationships that inspires and informs, be sure to like this video and subscribe to the channel so you don't miss what's coming next. Also, please drop a comment to share your thoughts and questions. Hi, welcome to the first episode of Talking About Sex Issues for Helping Professionals. I'm super glad that you're here. My name is Martha Kauppi, and I'm a marriage and family therapist and a certified sex therapist. I train therapists and other helping professionals all over the world to work with sex issues. And I really want to talk to you today about why you might talk about sex issues and how important it is. So let's get started. First, are you a therapist or a coach? If you are, this series is definitely for you. Even if you're a generalist, maybe you've not got any education in working with sex issues, are uncomfortable talking about sex and have never done it, that's okay. I'm totally here for you. It's also relevant to other helping professionals like clergy, medical professionals, and lots of other helping professionals. Although, because I'm a therapist, I'll be primarily speaking from my experience as a therapist and an educator. I want to start by telling you a story from my own therapy practice that absolutely changed the way that I think about working with sex issues. Years ago, I worked with a client who'd come to therapy, as it turned out, because of a sex issue. I found this out in the first session, but she told me a story. Before we started working together, she'd seen three different therapists. And even though in all those cases, the reason she came to therapy included working with a sex issue, she hadn't discussed it with any of them. She didn't bring it up, and they didn't ask. Maybe you're thinking she should have brought it up because therapists work with what's important to the client. And that's a fair point. I thought it was intriguing. So I asked her what had prevented her from opening the topic. And she said, I didn't bring it up because I knew that they weren't comfortable talking about sex. Well, that's interesting. I asked her how she knew that. And she said she knew that they weren't comfortable talking about sex because they hadn't brought it up. So while it's a projection to make an assumption about your therapist, there is something here that I think is really important, and it speaks to the way many cultures relate to sex and sexuality as being something taboo, private, not a thing to discuss, not a thing to bring up, uncomfortable material. And, I think we would all be talking about sex and therapy just like we talk about every other aspect of day-to-day life if it weren't for this taboo. So think about this. Um, she assumed that her therapists were not comfortable talking about sex. She thought to herself, it's a normal part of life, so why wouldn't they bring it up unless they were massively uncomfortable with it? She concluded that if she were to initiate the conversation about sex, they would really think that she was a freak. Obviously, that's not what we want our clients to think, and we obviously want to talk about what's important to them. When it comes to really difficult topics that are hard to talk about or even that are culturally taboo, we might have a very important role in initiating the conversation. To be clear, this is not an isolated incident. I've heard lots of stories like this, and I've worked with many clients who've had difficulty finding a therapist who felt comfortable working with sex issues. So for me, this says something. It says if you don't ask your clients about sex, they probably aren't going to tell you, even if sex is the exact reason that they came to therapy. Who knew? So a lot of therapists assume that they should wait for the client to bring it up, and it would be invasive if they ask, that they're going to make their client uncomfortable. Particularly, I think therapists worry about a client who isn't comfortable talking about sex and maybe doesn't have a sex issue that they want to discuss. But this story and the many other incidents like this that I've experienced as a therapist suggest to me that the opposite is true if you don't ask you might be missing something huge. But before we move on, I want to just mention a client who doesn't have anything about sex that they want to talk about. So part of the way that I work is I'm helping my client have a voice of their own, even to the point of encouraging them to share with me what's true for them, even if we don't agree. So I would say to my client, is there anything about sex or sexuality you think you might want to talk about in the course of our work together? And if they say no, I would say, great, no problem. If anything occurs to you at some point, just know that this is a safe place to talk about it. So I've found language around this that respects boundaries, respects consent, invites a conversation, but doesn't demand a conversation. And you can use my exact wording on this. Your client's going to project things on you. So one thing they'll probably project is that you're going to judge them for having sex issues or for whatever it is that they like about sex or don't like about sex, want about sex or don't want about sex, the amount of sex that they're interested in or not interested in. Basically, when it comes to dispelling sexual shame and the culture of silence around sexuality, you need to be proactive. You can't just be neutral. And the beautiful, beautiful good news is that you can make a huge difference if you do. You can help shift the experience of sexual shame just by bringing up sex. You know, I consult for therapists a lot, and very often I'm asked, how do I work with sexual shame? And it's a big, big topic. But just bringing up sex is, in fact, dispelling sexual shame. And for many clients, you'll be giving them a reparative experience. And for the ones that don't want to talk about or aren't ready to talk about it or don't have an issue that comes to mind right now, you saying, great, no problem, we'll go on to other stuff, but let me know if something comes up, is also a reparative experience because people are used to being railroaded into talking about things they don't want to talk about. And that's not what I want in the work that I do. And I think it's probably not what you want either. When we decide to not do something, it's also a choice. We think about the choice to do something, but the choice not to do something also has impacts. So, what's at stake when we decide not to bring up the topic of sex? First and foremost, I think we can just miss really important issues. And we lose the opportunity to create this deeply healing experience of talking about issues that the client faces around sexuality, or by backing off of it and just saying, no problem. What's important to you is important to me. So, just simply the missed opportunity to dispel sexual shame in that manner is an enormous missed opportunity. I want my clients to know that I think sex is a normal part of life. I think it's okay to want it. It's okay not to want it. Whatever you experience about it is something that I would like to talk about if it's important to you. So when we don't bring up sex, one impact we have is we send the message that we're not comfortable talking about sex or that sex is a taboo topic, or maybe that it's simply unimportant. But therapy is supposed to be the place where we turn to for help with all of the complicated, scary, intimate stuff. If your clients can't talk to you about this, who can they talk to about it? Many, many, many people have told me they don't talk to their partner about sex. They don't talk to their friends about sex. So who are they going to talk to about sex? With your clients, could you be missing something really important in their relationship with themselves or in their relational dynamic? Something important about their health and well-being that's related to sex and sexuality, sexual function, something you could really help them with if only you knew it. Here's another important aspect to consider. Most people have sex issues at some point in their lives. I think we've been taught to think about this as something rather niche, something that calls for a specialist, but I want to give you a little reality check about that. When I'm talking about sex issues, I'm not talking about anything particularly niche or obscure. I'm talking about super common challenges like desire discrepancy, sex pain, Challenges communicating with a partner about something that isn't working, or something you'd like to do differently, or something you'd like to try. I'm talking about dealing with changes in our sexual experiencing as we age and go through different life stages, experience shifts in our physiology related to any number of things, including aging, which is something that we're all participating in at all times. This is the kind of stuff that almost everyone has to deal with at some point. I would say all of us, actually, since we're all engaged in aging. Our sexual experiencing is going to shift, but I think there's a lot of mythology about age and sex and sexuality that as we get older, sex gets worse or becomes eventually unimportant or not something that's accessible. And I would say that may be true for some people, but it is not true for everybody. And I've worked with a lot of people who never got the memo that there are things that you can do to maintain your connection with your intimate, sexual, erotic self if you want that as you age and move through different life and relationship and family stages. Let's just take a minute, take a breath, get grounded. How's this landing for you? Maybe you're already asking about sex with most or all of your clients, in which case, gold star, that's great. And also stick with me in this series because you still might learn some new tools. And I'm wondering, are you feeling like, ooh, how the heck would I even start to do this? Or are you worried about going outside of your scope of practice? Maybe you're worried about making your client uncomfortable if they don't want to talk about sex, and I haven't laid your fears to rest yet. Are you wondering how to handle it if there is sex pain or desire discrepancy or erectile dysfunction or some other sex issue that you don't know very much about? Maybe you're just generally tense about the whole topic or some combination of all of these things. Can you imagine opening a conversation about sex with your clients? And I wonder how you would do it. For a lot of helping professionals, these questions raise some anxiety or maybe a lot of anxiety. That's okay. Whatever you're feeling and whatever your current approach is, I hope you'll stick with this series because these are the kinds of questions I'll be exploring. And I think they're really important to consider. In the end, I think you'll be in a different place than you are now about it. You'll know a lot more about it. And then I think you'll make a good decision for yourself about how you want to handle the dilemma of bring it up, don't bring it up, talk about it, don't talk about it. Now, I am very sensitive to the fact that as therapists, we get a lot of shoulds thrown at us. We're helpers, we care a lot about doing right by our clients, and we're constantly hearing or maybe just fearing that we're not doing enough or not doing it right. So, even though I do believe that talking about sex issues in the course of our work is very important, I'm not going to tell you you need to do this and then leave it there. We don't get a lot of guidance on these issues, and that's why I'm here, and that's what I'm here to help with. So, if you're feeling anxiety in any way about any of these aspects of working with sex issues, I want to encourage you to set the how aside. You don't have to figure this out on your own. I'm going to help you. You can just follow along with me in the series. And I think you're going to get to a place where you feel much more confident and able to make a choice. So instead, ask yourself, where do you want to get with this? And I would encourage you to just take a minute and think about that. Get grounded in yourself. Where do you want to get with this? Maybe make a note for yourself. If you allow yourself to set aside the concern about how, is there a part of you that's interested in including sex issues in the regular course of therapy or your other work? How would it feel to you to be truly confident and competent when it comes to talking about sex? What would that be like for you? Not for your client, but just for you. And what do you think might be possible or begin to open up as possible for you and your clients if that were the case, if you were truly confident and competent to work with sex issues? What would that be like, and what difference would it make? Just allow yourself to let that in for a minute. These are some big questions and they're important ones. When you let yourself think of a goal, a place that you'd like to get to, and take a moment and write it down, then you can keep track of it. You're going to have to think of your own aspiration. Maybe it's something like, I want to feel comfortable and confident bringing up sex in therapy. That's a great goal. Or maybe it's, I'd like to fill in some knowledge gaps and get a resource list together so I feel confident learning more. That's a great goal. Or so I feel confident bringing up sex. That's a great goal. Or maybe it's something else entirely. Maybe your main worry is that you're not sure if you bring it up, how to pivot if they're uncomfortable. That would be a great goal too. I'd like to feel comfortable bringing it up, knowing that I can pivot and trusting the pivot. Terrific goal. So once you have noted for yourself, where do I want to get with this? My next question is, why does it feel important to you? Again, don't worry about the how. That's my job. Figuring out where you hope to get and why it's important, that's your job. Join me for the next episode. We're going to be addressing some of the common self-of-therapist issues. That's the stuff that happens within you that surfaces around this topic for a lot of people. This would include things like contending with the messages we've all received about how sex is taboo and the fear of judgment around bringing it up, how to approach talking about sex when you feel like you have some unresolved challenges yourself around sexuality, how to feel confident when you don't have all the answers, and honestly, who among us does? And I think by the end of the next episode, you'll have some language to start using with your clients that I think is going to help. So if you stick with me for the entire 4-episode series, I'll provide, I think, all you need in order to get started bringing up and discussing sex in therapy with confidence and competence. There's a lot here. It's all free. My mission is to change the culture of talking about sex as helping professionals. And so tell all your friends, and I hope that you'll decide at some point to take my challenge and really see what kind of transformation you can experience in your practice. The reason I hope for this is because I know from my experience what an incredibly satisfying experience it is to watch somebody just be mind blown. Oh my gosh, this is a topic I can talk about with you. What a relief. It's so beautiful to be that therapist. So you'll learn more about how and why this is so important, as well as how to do it. I'll see you soon in episode 2. Thanks so much for watching. If you found this helpful or inspiring, please give it a like. If it brought up some deep thoughts or new questions, that's great. Please leave a comment or a question. I'd love to hear from you. And if you want to make sure you're always part of the conversation, hit subscribe, and I'll see you soon in my next video.